With mole removal and wart removal, the three main techniques we use. It depends really on what we're treating. Moles can be classified, or the way I sort of think about them is safe moles, dangerous moles, or potentially dangerous moles, and then superficial and deep. Okay, so basically potentially dangerous moles, or moles that might be medically troublesome, go straight to a dermatologist. We don't touch those. But then there are moles where there's a nice long history of 10, 15, 20 years without any change. They look normal, they satisfy all the medical criteria. Then basically there are two basic methods of removal. One method is to cut round the mole very, very carefully and stitch the wound, bring it together, and I have been doing that for the best part of 25 years, but it's very, very difficult to do well. So if somebody's got a critical mole, say in the middle of their forehead or here or somewhere, I will generally, and it's a deeper mole which needs excision, then I will generally refer to one of our plastic surgeons who will give a very, very good result. If it's a superficial mole, then what I tend to do is take a section of the mole off, put that in a pot, send that to a lab, and then for the rest of the mole we shave that down using a technique called radiosurgery. And what happens is that we take it down to skin level, smooth out the area so that it blends in perfectly with the surrounding skin, and then cover it with a plaster with some Vaseline on, and that stays on for 2 days. After 2 days of keeping it dry, the patient takes it off and lets it dry and scab. Once the scab falls off, you'll have a red mark. Now, on the face, normally it's the colour of the lip, and then it fades within a few weeks, maybe 2 months, 3 months, something like that. Sometimes it can be a lot longer. On the body, it tends to be quite red, and what we find is that it takes maybe a year to fade, maybe a bit longer.